The impact of the COVID-19 pandemic on patients with cancer. Governments have responded to the pandemic by limiting contact between people and focusing healthcare resources on the critical needs of patients with COVID-19. These measures have impacted the diagnosis and treatment of cancer. Patients with cancer are disproportionately affected by COVID-19 and are at higher risk of infection and death. During the pandemic, their cancer care has suffered. Some have been reluctant to seek care and some have experienced delays in access, affecting presentation, referral, diagnosis and treatment. Some patients do not present with their symptoms of cancer and there have been fewer referrals. These delays can increase mortality. Here we see predictions for the UK showing an increase in avoidable deaths from lower presentation rates for screening or non-urgent referral. Another UK study predicted more avoidable deaths as the backlog of referrals grows. Rapidly providing additional diagnostic capacity to meet a 50% backlog in referrals could lead to 183 avoidable deaths in this setting. Delay in this extra capacity is predicted to lead to over 4 times this number of avoidable deaths. Let's now look at treatment. Delays in starting treatment can be associated with increased mortality. During the pandemic, use of surgery has decreased and chemotherapy has been delayed, increasing anxiety among patients and placing them at higher risk of death. A 6-month delay in surgery is predicted to lead to over 10,000 excess cancer deaths over 5 years in the UK. Some efforts have been made to reduce the backlog of care. For example, telemedicine has been widely adopted and many patients have moved to self-administered medications. But despite these adaptations, there is an increasing number of undiagnosed and undertreated patients with cancer. They continue to be disproportionately affected by the pandemic and face considerably worse outcomes than before COVID-19. The evidence and insights shared here form an urgent call to action for us to work together to increase capacity in cancer care for patients.